I'm pleased to discuss our study of a novel approach of trying to enhance the efficacy of CAR T cells by adding a PI3 kinase during the manufacturing process of CAR T cells. This is work that was inspired by frustrations we had that manufacturing will occasionally fail during CAR T cell therapy, such that patients who were scheduled to receive an infusion of CAR T cells could not do so because their T cells failed to grow at the manufacturing site. So based upon this, we went back to the laboratory and tested the hypothesis that a PI3 kinase inhibitor added to T cells growing in the laboratory might enhance their expansion or efficacy. We published some initial findings from this approach in Blood Advances in 2018 and are pleased today to present a further development of this concept using T cells expanded from patients with chronic lymphocytic leukemia and infusing CAR T cells generated from those patients into a immunodeficient mouse model bearing a human CLL cell line. This work was done primarily by Ronnie Funk, who at the time was a Howard Hughes Medical Institute funded medical student working in my lab. He's gone on to start his residency at Emory, as well as his collaborator and our postdoc in the laboratory, Shuha Wang. What we found is that adding a PI3 kinase inhibitor, Duvelisib, significantly improved the total numbers of T cells that could be generated during CAR T cell manufacturing, a 150% increase in the number of viable T cells compared to control cultures that lacked Duvelisib. And significantly, it also increased the number of CD8 T cells, normalizing the CD4-CD8 ratio compared to control cultures where CD4 T cells predominated. We also found significant changes in the phenotype of CAR T cells expanded in the presence of Duvelisib. We found that the levels of co-stimulatory molecules, CD27 and CD28, were significantly increased when Duvelisib was present during CAR T cell manufacturing, and levels of co-inhibitory molecules, TIM3, LAG3, were also significantly decreased in a dose-dependent manner in the presence of Duvelisib. PD-1 also went down, although the change was not as significant as we saw with TIM3 and LAG3. Comparing the anti-leukemic activity of Duvelisib expanded CAR T cells, we found that Duvelisib treated CAR T cells had increased cytotoxicity in vitro and increased cytotoxicity in vivo in NOG mice engrafted with the human CLL cell line, such that the Duvelisib treated CAR T cells had greater in vivo expansion and could eradicate the CLL to a greater extent than conventionally treated CAR T cells. So we conclude that adding a PI3 kinase inhibitor during CAR T cell manufacturing may be a very simple and cost-effective way to increase the efficacy of CAR T cells such that patients can achieve a more durable remission, such that a greater number of patients may achieve a durable remission. And we're planning to test this hypothesis in a proposed clinical trial of mesothelioma CAR T cells that we'll use to treat pancreatic cancer patients. Thanks for your attention.